Okay. So, good morning once again, dear all respected participants. This is a session basically on about the emergency response. So, when it comes to the emergency response, the very important thing which we are going to learn now is about the various skills. So, when it comes to the various skills, as you understand the disaster and the disaster management in this course, the very important the number of death is increasing in India, not only because of the natural disaster. So natural disaster, we get an alert, for example a cyclone, or for example the rainfall pattern, we get an alert, we can take measures, we can shift the people, we can evacuate the people. But when it comes to particularly related to the man-made disasters, it is very important that we don't get any alert at all, and many people actually die in such accidents or such disasters. So we'll be starting to understand briefly about what all the various disaster we are prone for. Then we'll go further into the various first aid issues, the emergency life saving issues which is related to that. To start with, the what will be priorities in managing a mass casualty, that also we will understand in this session. So when it comes to a mass casualty, means to say a major disaster which can kill hundreds of people and which can cause death or injuries to thousands of people also. You remember these train accidents? Nowadays it is frequent. The number of the train accidents or the bus accidents are increasing. That again is classified as a disaster. So as you understand, the disaster is a situation which cannot be managed locally with the local capacities and the local responses, which needs external assistance. So let us discuss in brief about what all the various disaster which we are prone for, and what all the life skills that is required for that. So this is again one of the picture from train accident somewhere in North India. If you remember the last year accident that happened in at Odisha, where there was a triple train tragedy killing around 550 people and injuring more than 1200 people. There was a three train collided which were moving in a same track. So that resulted in major casualties, and the emergency responders were totally, actually initially first 2 hours it was totally difficult for them to shift, lift, provide first aid and provide medical assistance to thousands of people. Because when it comes to first responders, we have only three departments, that is police, we have fire department, home guards, or the civil defense department. The external assistance may be NDRF, as you are aware, regarding the National Disaster Response Force, or the NDMA, National Disaster Management Authority. So let us basically understand what all the various disaster we are prone for. If you look into the various disasters which we are prone for in our country. So basically, to start with, our nation is prone for natural disasters as well. So this is a map of India which is showing you briefly, that is the various disaster that can be seen in our nation, which includes flood, which includes cyclone, drought, and other thing. So if you see the map of India for the last 30 years, you can see basically here the very important is the major disaster is reported in the northern and the central part of India. The southern part of India, what we have seen, that is tsunami 2004 was the severe one. And generally in the southern part of India, we see the cyclone in the Indian Ocean, which will be affecting Andhra Pradesh or Tamil Nadu. Particularly the Karnataka state, geographically we are located in a safe location where the chances of natural disaster happening here is comparatively less. So based on this prevalence, the National Disaster Management Authority has classified the states depending upon the severity of the disaster. In that, the 12 states are considered to be the disaster prone, and the Karnataka is not considered coming under the 12 states. So we are in the safe zone. There was no major incident or major disaster that has been reported from Karnataka except the 2019 Coorg flood and the landslide. Other than that, there was no major incident. If you remember, way back in 2009 also there was an incident, that was the major North Karnataka flood that was reported. So anyway, we will go into detail not only for the Karnataka, in general for all over India, how much we are prone to the various disasters. Then we will go step by step about the various other aspects as well. So if you look into the map of prevalence of
Excuse me, sir. It's not
yes,
in full mode, sir. Screen.
it's not opening, madam. Full mode, it's not opening. Probably some issues here with the network. I tried it, madam. Full screen was not coming. I tried it initially. Let me try that again, madam. 1 second. No? I'm putting into full screen mode only.
Sir, try slideshow, sir.
I tried slideshow also, madam. I checked it initially. The full screen was not opening, madam. That's why I made it into this view only. I have put it in the full screen mode only now. In my laptop, it is showing a full screen and the slideshow, madam. Let me try again, madam. 1 second. I'm trying this again. One moment, madam. One moment. Is it visible, madam? Full screen mode.
Yes, sir.
The screen is visible, but it's not in the slide
The
show.
slide mode. No, madam. There is a problem somewhere here in my either in my laptop or the network issue. That's
That's
the
okay, sir. I
reason.
think please go ahead.
Yeah, yeah, yeah. Definitely, madam.
It's okay, sir.
Okay, so we were discussing about the prevalence of disaster in our nation. More than 60% of the landmass in our country is prone to the earthquake. So, why this knowledge is very important and essential for everyone, and particularly for the college students, is the reason that's a role. You being teachers, you being the professors, academicians, definitely can sensitize our students regarding this issue, because we are not aware about the simple do's and don'ts of the major disasters. Particularly for earthquake, we generally assume that the running out of the building is the right option, but that is not the right option, running out of the building. So please do sensitize. So at the end of this session, I'll be briefing you about what are the simple do's and don'ts regarding the major disasters. So let us focus on the life saving skills and the first aid. So only 60% of our landmass in our nation is prone to earthquake. So that is one of the thing which we need to focus when we discuss about the issues. The second thing what we are seeing nowadays is the landslides. I mean to say the stampede. The stampede is becoming the major incident that is reported in India now. Stampede either during a sports victory rally or during a religious function. So in the last 1 year, more than 10 incidents of stampede has been reported, killing more than 350 people. So stampede is one of the disaster where the first aid assistance may be required. So this information shows that 19 this was earlier information. Now it is 10, including the Tamil Nadu incident that killed many people. The Tamil Nadu incident where the political rally was conducted that resulted into a stampede. So stampede is becoming one of the man-made disaster which we are facing now, and 12% of the area is prone to floods in India. So when it comes to floods, we have to understand how to save a person who is drowned in water, how to do the first aid, how to rescue him. So what should be the priorities? What should be the first priority when we are helping a person who is drowned? That we are going to discuss now. That is basic life support. And when it comes to drought, 70% of cultivable land in India is prone to the drought, and particularly the Karnataka state stands second next to the Rajasthan. Rajasthan stands number one in the country for the drought prone. The second one is the Karnataka state. So during the drought also there will be many diseases that will be spread, and during drought there will be acute scarcity of food and water. So this again one of the important issues that need to be understood by the first responders when providing first aid issues. So this is briefly we are discussing about the profile. We'll go to the first aid part, and the 8% is area is prone to the cyclone. So you may be aware regarding the cyclone nowadays, it is becoming very common. The cyclone is like the most common. We started naming the cyclone. The reason why we started naming the cyclone is because in a year more than 3 or 4 cyclones are reported in every year. So that is one of the reason the cyclone naming is started. And the commonest thing is among the natural disaster which we come across is a cyclone. And the next thing is flight crash. So this again was a disaster that was ignored initially, but nowadays, after the Gujarat incident, a lot of care has been taken regarding the safety of related to the air crashes. And every month, almost all the airports in India are doing the mock drills. They are conducting regular exercises. They are conducting regular safety checks. They are conducting a lot of first aid training. So last week I was at Belgaum Airport for conducting training regarding the safety and the first aid issues related to emergency response on a flight crash. So nowadays there isn't much awareness regarding this, but still this is again one of the technological disaster which we are facing, which our country is facing. So compared to the natural disaster, we are facing more of a man-made disaster. If you remember the tragic air crash that happened in the past in Mangalore that killed hundreds of people, if you remember those incident, that again requires a first response. So any disaster for that matter requires a first aid response in the golden 1 hour. We cannot, it may be practically impossible to shift these people, injured people, within half an hour or 1 hour to the hospital, to the nearest hospital. So the first aid will save their lives, preserve their lives, prevent the aggravation of that condition. So knowledge of first aid is very essential as a part of disaster management. And we have been appealing that this should be part of our curriculum also, either at the PU level or the graduation level, because once a student knows about all these issues, the life-saving skills, definitely they can come forward and help the people during such emergencies. And one more disaster which we are seeing now, that is regarding man-animal conflict. So this is reported almost every week in our nation. Every month, many incidents related to elephant attack, cheetah attack, or many man-animal conflicts have been reported. And when it comes to man-animal conflict, the very important thing is there will be a lot of injuries. There will be a lot of things that need to be considered, particularly from the forest department regarding the mitigation of the man-animal conflict. But this again, why a villager requires a knowledge of first aid is because all these issues are they are prone for. So when it comes to natural disaster, probably we have few things to say like earthquake, flood, cyclone, and tsunami, so that we get an alert other than the earthquake. But when it comes to man-made disaster, we don't get any alert, and we become victims. We become our people get injured in such incidents. So man-animal conflict is one of the important things to be remembered. And the number one killer is the road accidents. So road accident is the number one killer in India compared to any other diseases. The number of people who are killed in the road accident is very high. So it is around 1,60,000 people are killed in the road accident every year, and more than 4 lakh people are permanently disabled. So this again is an important issue. There, it is not classified as a disaster, but first aid role is there. The role of life-saving skills is there in such a major disaster. A major bus accident definitely can be classified as a disaster only, which can kill tens and probably more than 30 or 40 people. The recent incident that happened at Hyderabad, if you remember, the fire tragedy that killed more than 35 people who were traveling in a sleeper bus. So there are many such incidences that has been reported across, and the major incident which we are facing now is road accident that cannot be categorized as a disaster, but definitely we needs assistance, needs a first response. And one more phenomena among the natural disaster which we are seeing now is lightning. So lightning kills around 5,000 people every year in India, and the lightning mitigation measures are taken, and there are a lot of measures taken regarding creating a awareness regarding lightning. What are the simple do's and don'ts? So this again requires a first response. So I'm just briefing you about what all the various disasters which we are prone for. We are going now into understand how first aid will help, and what are the various things, what are the various concepts involved in the first aid. So when it comes to lightning, as I mentioned, there are many apps which will can give you alert. If you remember the Sidilu app that has been developed by the Karnataka State Natural Disaster Monitoring Center of Government of Karnataka. So the Sidilu app will give you an alert prior almost 1 hour in advance if there is a lightning strike happening at your place. So it will give you a red alert that will indicate that the people can go to the safer places during lightning. So there are various technologies, there are various methods to minimize the injuries, minimize the death during disaster, but people are unaware about it. The most of the people are unaware about it, and it is our duty as part of this training. I appeal you that whatever the knowledge you learn from this training, it should be carried forward. It should be made learn to the students, so make others also aware regarding these simple and the various life saving measures. So first we start with what is emergency response, what is golden hour, and what is platinum 10 minute. So golden hour means to say the first 1 hour. The first 1 hour, the very important in disaster is search and rescue. It comes to life saving only in the first 1 hour to 24 hours. So when it comes to the life saving, so we have to remember the very important thing how we conduct this life saving search and rescue. So the golden 1 hour means to say within 1 hour, a severely injured person needs to be shifted to the hospital, and care should be taken about immediately. He should be surgically intervened. That's a golden 1 hour we say. And we categorize the injuries also into red category, yellow category, green category, and the black category. Black means to say the person who is dead. So we categorize before shifting, because disaster is a site where not one or two or 10 people are injured. The in this disaster, more than 50 people or 100 people will be severely injured. It is practically impossible to shift everyone at the same time to the hospital. So we have to prioritize, we have to categorize who needs assistance first. So in that categorization, definitely we have to have a set of skills. So we categorize into four category. Remember, we call this as a triage. Triage is a process of categorization of how the injuries or injured person need to be shifted to the hospital, and a proper first aid can be given. So we start with the triage. What exactly is a triage? So triage means to say, it's a French term which means to say choose and pick. So prioritize and pick. So triage was practiced, if you remember, during COVID. If you remember 2021 and 2020, particularly 2021, triage was done. Why triage was done? Because we had a lack of facilities at the hospital, lack of oxygen supply, lack of medication. So there was a severe lack of even the medical practitioners. So in that situation, we prioritize. If you remember the COVID, we prioritized into those who are having symptoms and the comorbid was hospitalized, those who were symptomatic were treated at the COVID care center, those who were asymptomatic and the COVID positive were treated at home only. So that is the three category was done. In the same way, the triage basically meant for injuries management in any disasters. So how we do that? It's a simple process. The process is very simple. It's called 10-second triage. So for each patient, the first responder need to spend only 10 seconds. Please remember, not more than 10 seconds, because every minute is very precious in that incident. So we categorize into three category. What are the three category? If you see the lower part of this picture, you can see a person who is unconscious. So category 1, red, means to say in any disaster, whether it's a building collapse, whether it's a landslide, whether it's earthquake, there is a person who is unconscious, who is breathing but severely injured. So he will be given the first category. The second category is that is a person who is severely injured, but he is talking, he is responsive. That is yellow category. Yellow means to say second category. We first shift the red category followed by the yellow category. So the red category means to say like the person who is unconscious, who is breathing. Please understand who is breathing. And the third category is called walking wounded. Walking wounded means to say who is injured, who is able to talk and who is able to walk. So their number will be large number in any disaster for that matter. The number of the people who are able to walk, who are able to talk will be more than 60%. It's very difficult to manage them because they are able to talk and they are able to walk. They will approach the first responder, they will approach the ambulance and insist that they should be shifted first. But practically, you should be prioritizing the person who is unconscious first, not the person who is conscious and able to walk, because everyone cannot get a immediate attention because of the when there is a lack of facilities at that moment. If you remember a triple train tragedy of Odisha, three train accidents was there and 1200 injured was there. It is practically impossible a nearby hospitals within 50 kilometer can accommodate these 1000 people. So we have to prioritize who is severely needing assistance, whose life can be saved. That is called triage. So that is red. Please remember red, yellow, then green. Green means to say the minor injured. So this practice is there throughout the world. Okay, this has been very effectively implemented in the Western countries. It is very effectively, but in our nation, it is practically not followed except the two department. Army is well trained to do this triage and they do the triage deal, and the second one is Airport Authority of India, which do practice the triage. But the civilian departments or the various other departments like police or fire department, they have less knowledge about the triage, and probably that knowledge sometimes it's very essential, and the training also is very essential for them at that particular incident. So triage means to say categorization. Please, it's very simple to understand. Three category. What's the fourth category? What is black tag? We tie the tag. If you can see the low part of this picture, the immediate priority means to say within 1 hour he need to be shifted. A red category. So what is black tag? Black means to say the person who is dead. So in the field of the disaster, we may not be able to certify a death. So it is a duty of a doctor, but we can, by superficially appearance, we can make out the person as dead based on whether his body is opened. For example, if head is opened after an injury, abdomen is open, definitely he cannot survive. So based on the ABC assessment, ABC assessment means to say airway, breathing and circulation assessment also, we can take a decision as a person suspected to be dead. Okay, we cannot certify that. We can tie a black tag, no need of shifting the dead bodies. So dead bodies can be attended maybe after few hours, but immediate priority is to save the lives. So we save the lives according to the priority, that is first response. Remember the triage, remember the four color coding. Color coding is red, yellow, green and black. Okay, we'll come to the first aid part now. So, how do we do the assessment? So, triage, I just mentioned what is a triage. Remember the categories here, that is immediate, delayed, minor, and deceased. So, when it comes to immediate, remember unconscious or semi conscious, or a person who is internally injured, head injury resulting into bleeding from the nose, head injury resulting into bleeding from the ear, that comes under the red category. Abdominal injuries comes under the red category. Delayed, that is yellow, person is conscious, he is shouting and crying for help, he is conscious but he is injured, that is second category. Minor, as I already mentioned it. So remember this is again a technical skill which is not done by the paramedic, not done by the medics. Means to say, the doctors will not be at the field of the disaster. They will be working at the hospital. The paramedics and the first responders are trained for the primary triage. There is something called secondary triage that will be done at the hospital level. So now it is mandatory as per the NABH. NABH, you may be aware about NABH accreditation of the hospital. It is very important that every hospital need to have the triage area. So whenever large number of the casualties are brought inside, So what exactly they do is they assess, they do the retriaging. That's called secondary triage. So primary triage is done at the hospital level. The secondary triage is done at the primary triage is done at the field level, at the disaster site. The secondary triage is done at the hospital level. Okay. So now I'll come to the field level part, that is first aid part. So remember, it is called keep it simple. The triage is called. So how exactly we will be using such triage card? So this is a standard triage card which is there all over the world. So our 108 need to equip with these things. So if you ask a 108 ambulance person to regarding what is triage, do they have the triage card, they will definitely ask you back what is triage. Means they are unaware and they may not be trained. They are trained to manage day-to-day emergencies, not disasters. So when it comes to disasters, it's a large number of people. Triage should be followed. So we are going to the next part. That the next part is regarding basically what is first aid and when it need to be done and how it need to be done. So first aid is a knowledge, it's a skill, it's a first order intervention before the arrival of medical help or before shifting the patient to the hospital. We do this procedure to preserve the life, not saving life. Saving life is it's a duty of a doctor. When it comes to preserving life, that is a duty of a first responder. So the first responder duty is to save the preserve the life. So how we preserve? What is the difference between saving and preserving? Preserving means to save. For example, if he is not breathing, the person is unconscious and not breathing. So we do exactly what exactly we do in that situation is we do a procedure called CPR, cardiopulmonary resuscitation. So cardiopulmonary resuscitation is a procedure where continuous supply of oxygen to the brain and the other vital organs of the body is maintained. In that situation, what exactly we do? We do the chest compression. We preserve the supply of the oxygen to the brain and other parts. So saving life definitely needs hospitalization and a medical treatment. So that is first aid. It's a any help that is given before the arrival of the medical team or the ambulance is called first aid. It is not a treatment, it's a assistance or a help. So what are the various concept involved in the first aid? So what is the priorities in first aid? So remember, we say 4 P's. The objective of the first aid is 4 P. The first P is to preserve the life. Preserve the life till the person reaches to hospital. For example, in an industry, an accident happened and a person is unconscious and not breathing after electric shock. So preserving life takes utmost priority till he reaches to the hospital. If the blood supply to the brain is preserved, he can recover from that. I remember the Puneet Rajkumar incident, the tragic incident of Puneet Rajkumar, where he died of a heart attack, as a tragic example of preserving life. Means to say, uh, so he had chest pain. He reported to a clinic. Puneet Rajkumar, you may be aware, regarding a very famous personality in Karnataka and in India. He had a heart attack and he reported to a clinic with a chest pain. So when the ECG was done, so they detected few changes in the ECG and they referred to the Hare Hospital. There he collapsed. He was shifted in a private vehicle. During his shifting, it was around 20 to 30 minutes they were on the road in the private vehicle. It's not an ambulance, it's a private his own car. So in that time, if somebody intervened by providing CPR, the cardiopulmonary resuscitation or the chest compression, the chances of Puneet Rajkumar's survival would have been increased by 80%. So nobody did anything. Means to say they were unaware what is CPR. The people, occupants of his car, family members or bodyguard or these staff members, unaware regarding the CPR. They should have opted for an ambulance. Anyway, lot of lesson need to be learned from such incidents. But that was a case of a heart attack where a life could have been saved with a proper care. So preserving life means to say supplying, maintaining the blood supply to the brain. So as you know, the science says that the platinum 10 minute means to say the first 10 minute after a person stops breathing and unconscious, the brain will be alive for 8 minutes only. After 8 minutes, brain will get damaged irreversibly, which cannot be reversed, which cannot be repaired, or which cannot be corrected with any medicine in the world or any doctor in this world. So please understand platinum 10-minute. So I was telling about the Puneet Rajkumar incident for the very reason that everyone knows this famous personality, know the Puneet Rajkumar, how death has happened, and everyone know that there are such hundreds of example every day happening in India. But we need to learn a lesson. So please understand, platinum 10-minute means to say if a person goes for unconsciousness and not breathing, immediately CPR need to be started. The blood supply need to be preserved to the brain. If the blood supply is not preserved to the brain, he will not recover with any treatment. So that is need to be understood. Please understand what is preserving life, and please understand if the after the breathing has stopped, so for the first 6 to 8 minutes the damage can be reversed, but after 6 to 8 minutes the damage cannot be reversed. We call that as a platinum 10-minute. Platinum 10-minute is the first 10 minutes after a person goes for unconsciousness. So please understand, golden 1 hour is different, platinum 10-minute is different. Golden 1 hour applies to the injuries, not to the heart attack. So golden 1 hour applies to the injuries. Heart attack applies, the time is platinum 10-minute. In case of a heart attack, this is not actually under the scope of this today's topic of a disaster regarding heart attack, but I am sensitizing because heart attack is becoming the number one death in India, the number one reason for death in India. So that the statistics says that nearly 6 lakh people are dying in every year due to heart attack. So most of the, not the cardiac arrest, as you know, the cardiac arrest is different and the heart attack is different. Cardiac arrest is massive and sudden. It is due to the electrical supply to the heart, and the heart attack will give the person a symptoms will be there. So due to the partial blockage or the total blockage of the blood supply, the artery which supplies to the heart cause heart attack. So during heart attack it can be reversed, but cardiac arrest, it requires the support of other medicine as well as other equipment like EED, automated external defibrillator. So we'll discuss those issues later. Let us focus what are the primary objectives of the first aid. The first objective is to preserve life. The example which I quoted is to make you understand what is platinum 10-minute and what is preserving life. The Puneet Rajkumar incident I was telling, because in the first 10 minutes was very crucial. They wasted the first 10 minutes to 20 minutes. They didn't do anything. They were unaware about CPR. They just did the rubbing of hand and feet portion, and so they didn't do any other thing other than that. So anyway, there are a lot of lessons need to be learned from each major such incident that happens in our country. So second objective of first aid is to prevent worsening. If a person after an injury bleeding profusely, so we need to take a measure, first aid measures to prevent the situation from worsening. The third piece is promotion of recovery, like bandaging or providing safe transportation, or making him to place in a recovery position. So that is third P. So please remember 3P, and the fourth P means to say providing a safe transportation. So whenever you who are trained in first aid are providing first aid in any emergencies, remember the first thing is to be remembered is do not get panic, do not get emotional. The second thing, avoid overcrowding. So overcrowding is affecting the moments of emergency vehicle, moments of the casualties. So it is very important to prevent the overcrowding. The first measure that should be taken is to assess the danger. Assess the danger, then don't get panic, don't get emotional. Do the procedures which you have learned, which you have been trained with the confidence, and don't attempt a procedure which you are not trained, which you are not aware, which you have read or which you have probably seen in WhatsApp or Facebook reels. So please do never attempt. There are various medical procedure that is shown very wrongly in this Facebook or Instagram reels. Please never attempt that. That is not real. That is not correct also. So remember one thing in the first aid: the knowledge which you have trained and learned, you can confidently do it. The which you don't know, please don't attempt it. Okay. So we'll start step by step now. What are the things to be remembered? So the first aid cannot replace a medical treatment. That's the first thing. And be safe. Your safety comes utmost important. Then arrange to shift the casualty to the nearest hospital, and do not try to do. That's what I said right now. Do not try to uh, do which the things which you don't know, and do do not hesitate to do if you know that that's a thing to be remembered. So remember the emergency response, always emergency response, there is something called priorities. In the priority, we say ABC is the first priority. Means we check for airway, open the airway, then we check for breathing, whether the person is breathing or not. Then we check for circulation, means to say pulsation. So never give, if the person is conscious, you don't need to check for ABC. You can check for the injuries in the body. If the person is unconscious, then we start with the ABC, airway, breathing, and circulation. And if the person is conscious, don't give him water. So please remember, in the priorities, we have 10 priorities which never says give him water. But in any accident or in any disaster, people tend to give the casualties and injured water. If you give water, the person is already injured, he's taking a deep breath, and if you give water, that water may enter inside the trachea, it may enter inside the lungs also, so that can choke. So water doesn't comes as a priority. If the person ends up with a scarcity of water, or if he dies due to lack of water, it may take 24 hours. So immediate priority is breathing, oxygen, stopping of the bleeding. It's not the water. So water, if the person is fully conscious, or category 3 patients, that is the person who is injured and walking, he is talking to you, so for them you can give the, uh, you can definitely give the water. For the people who are semi conscious and not conscious, please don't give them water. Okay, so what will be the first priority? Let's the first priority is examination. How exactly we do the examination? So remember the Dr. ABC. Dr. ABC is a method how we do the examination. So what is Dr. ABC? D stands for danger. Check for the danger, and after checking for the danger, so we check for the response. We check for the response, and whether the person is conscious or not conscious. If the person is not conscious, the next thing what we do is immediately call for an ambulance. Remember the number, that is 112 or 108. Remember the number 112 or 108. We check for the conscious. If the person is unresponsive, immediately call for an ambulance and open the airway, check for breathing and check for circulation. So how we do that? So remember Dr. ABC, DRABC comes to your help in case of any emergency. So now it is DRABCDE, they say it. That is, D stands for defibrillation. It requires a practical skill to understand what is defibrillation. So let us limit ourselves to DRABC, Dr. ABC. So what is Dr. ABC? Remember, danger, whether you are in danger or whether the casualty is in danger, because it's a disaster site. Disaster site means to say it is not safe. Most of the disaster site means it is completely filled with the rubbles, and it is completely filled with a lot of high risk areas, whether it is a flood or a landslide, or whether it is a building collapse. So the utmost priority is your safety. Don't put yourself into risk, and don't try to enter into the field. If you are entering into the field, you need to have the basic thing to be remember: personal protective equipment. What is personal protective equipment? You need to have set of gumboot, you need to have set of helmet, you need to have abrasion resistant gloves. Then only we can do a good work and a safe work. So if you don't have these equipment, first is your safety, consider your safety, and then enter the field. Okay, so remember Dr. ABC, easy to remember the word. Dr. ABC: danger, response, open the airway, check for breathing, check for circulation. So how exactly we do that? Let's understand how exactly we do that. So this is called ABC, airway, breathing, and circulation. So first we check for the danger, right? So after we check for the danger, we open the airway. So opening of airway, why it is required? Because tongue will fall back for an unconscious person. For any unconscious person, tongue will go back and block the airway. So it needs to be opened. How to open? We will be using two fingers, I mean two hand. That is, one hand will be, the right hand will be kept on the forehead, and the other hand is kept near the chin and slightly tilted. So that is the method of opening airway. So we have to open the airway. You can see in the diagram here, the tongue is blocking the airway in the first picture. The second picture, you can make out that the tongue is open there, right? So after opening the airway, the next thing which we are supposed to do is checking for breathing. So how do we check for breathing? Look, listen, feel method. Please remember, don't use your fingers to check whether a person is breathing or not. So how do we check for breathing? Look, listen, and feel method. So we look for the chest movement, we listen for the breath sound, we feel the hot breath air through the cheek, not through the nose. Don't use this method. Never use this method. Only an uneducated or illiterate person can do this. A layman can do this using your fingers to check whether he's breathing or not. You cannot assess the breathing. A person cannot assess the breathing with this technique, because over years the fingers have lost the sensation. So if the person is breathing very feeble, you cannot able to assess it. The next thing is checking for pulsation. So most commonly we check for the radial pulse, but this again is a most misguiding pulse. Misguiding means in normalcy it is fine. In emergency, when a person is in a shock or a state of unconsciousness, this pulse will not be felt. The reason why this pulse will not be felt is it is located at the extremities of our body. Second, there is a condition called peripheral vasodilation, where this blood vessel will be dilated and blood will be rushing towards the heart and brain. So never try to feel this pulse. This is most misguiding pulse. In your college also, for example, someone collapses with a syncope. We call it as a transient loss of consciousness. Syncope, you may have heard about. The college students suddenly will collapse. For few seconds, they will be all right. That is called syncope, transient loss of consciousness. Why it happens? If they have skipped the breakfast, they have skipped the food in the morning or food in the night, they have skipped, they didn't had a proper sleep. Some girls are very anemic, that results into shock. We call it as a syncope. So in syncope also, if you check this pulse, it will not be felt. It doesn't mean that heart is not pumping, heart is not working. This pulse is not felt at all. So proper pulse to be felt is the carotid pulse. How exactly we do that? When we extend our neck, we can see the prominent voice box, and when you pass your fingers laterally, you can feel this pulse. So check for breathing, check for pulsation. If it is not felt, immediately we start doing the CPR. So remember what is CPR and when it is done. So we are going to learn a very important life-saving procedure now called CPR. How exactly the CPR is done, and what are the various steps involved in CPR, we are going to learn now. So first thing to be remembered, what all the conditions that can be called as an emergency. Lack of breathing, lack of heartbeat, it's an emergency. Severe bleeding, it's an emergency. Any state of unconscious is an emergency. Okay. So what does it mean? What does the emergency mean? Emergency means platinum 10 minute, golden 1 hour I will apply. You cannot delay. You cannot waste the time. Without wasting time, the person need to be shifted to the hospital if you don't know the first aid. If you know the first aid, do the first aid, simultaneously shift him in a vehicle. So please remember that. Okay, we'll start the CPR. What is CPR? You may have seen the CPR nowadays during any stampede condition, whether it is at Tirupati Tirumala temple. There was a stampede that was reported last year. Chinnaswamy Stadium, in front of the Chinnaswamy Stadium also there was a stampede reported. During both these situations, the people were doing CPR there. You may have seen that in the TV. The TV news clipping was repeatedly showing a lady was performing a CPR in front of the Chinnaswamy Stadium for a person who is unconscious with a stampede. Yes, definitely, this procedure will preserve the supply of oxygen to the brain. So, what is CPR? CPR means to say cardiopulmonary resuscitation. Cardio means to say heart, pulmonary means to say the lungs, resuscitation means to say a process of supporting it and reactivating it. Okay, so how exactly we do the CPR? Remember, CPR, cardia, heart, pulmonary, lungs, and the resuscitation is a process of supporting it. How exactly we do this? So when it is required, that is very important. So when it is required, so CPR is required in any condition where there is an absence of breathing and absence of pulsation. So this can be heart attack, this can be a condition of drowning in water, this can be a road accident and resulting into a bleeding and injury and unconsciousness. After an electric shock, in case of fire, someone is trapped in the fire and he has he is under asphyxia, lack of oxygen in that environment, that also can cause this severe asphyxia can cause requires a CPR. So how do we do the CPR? That's the next thing. So remember, earlier it was called as ABC method. Now it is called CAB method. CAB means chest compression first. Okay. So let us go step by step to understand this procedure, how exactly we do this. The first step, when we approach the casualty, the first step to be remembered is when we approach the casualty is to wake him up, try to wake him up. We try to find out whether he's unconscious, whether he's conscious. Okay. If he's conscious and if he's tired, he may open his eyes and respond to your voice command. So no need of CPR. If he's unconscious, so you immediately call for an ambulance, then you start with the next process. So if he's unconscious, first thing to be remembered is opening the airway, right? Opening the airway. So how we open the airway? As I said, head tilt and chin lift. So with this head tilt and chin lift method, remember, just observe the first responder there, how she is doing head tilt and chin lift. The chin lift is done using 2 fingers and the head tilt is done with the one hand. And this procedure is required. Why? To check for, or to open the airway, and we check for breathing. This is how we check for breathing. So check for pulsation after that. If nothing is felt, we go for the next step. So what is the next step? CPR, that is external cardiac compression, is the next step. So how exactly we do this? Okay, remember the landmark. The landmark is the center of the chest, not on the left side. So please remember, heart is located at the center, tilted towards left side. It is not at the left side. So please don't apply the force on the left side. You have to apply on the center of chest, and the bone is called sternum. So we feel the tip of the sternum, just 2 fingers above the tip of the sternum, we place our hand. So how we do that? So first locate the coastal margin. Coastal means to say this is the rib cage. You can see the rib cage in the picture here. So you can see the rib cage, and you identify the rib cage. Next is when you identify the coastal margin, you identify tip of it. Then go to the placing of your hand. So hands are placed at the center of chest. Remember, it's very simple. There is no what I can say a complicated scientific process is involved here. It's a simple mechanical process, can be done by anybody. A construction worker can do this, a labor can do this, a auto driver can do this, a truck driver can also do that CPR. So what you need to understand is where the heart is located. It's not on the left side. If we start compressing on left side, you end up with breaking the rib cage. Okay, so first we check for pulse, second we check for the ABC, airway, breathing and pulsation. If it is not felt, we place our hands like this and we start compressing. Okay, so how much compression need to be given, right? So what should be the force? So compression, when you are giving, it should be at the rate of 100 to 120 per minute. It should be at a rate of 100 to 120 per minute. Remember that. So for every 30 compression, we give 2 rescue breathing. So why rescue breathing is required? For oxygenation. All right. When you compress, what will happen? The heart will pump the blood to the vital organs of the body. In any disasters, whether it is a floods, whether it is a drought, or whether it's a earthquake or a landslide, a person who is unconscious and injured and person who is not breathing requires CPR. So what should be the depth of compression? The depth of compression is 4 to 5 centimeter or 2 inches. How to measure this? It's practically impossible to measure it, but approximately the width of the chest from the width of the back, 1/3 of the width we compress it. Okay, so please understand how much we compress: 4 to 5 centimeter, and holding our hand straight, not bending the elbow. Holding the hand straight is very important. Okay, to apply the proper amount of force. So how long we will be doing it? We'll be doing it till the ambulance arrives or till the person shifted to the hospital. And this procedure, this is what I was mentioning in case of Puneet Rajkumar, this was required. While he is being shifted, his chest need to be compressed. so that the oxygen supply, the blood supply to the brain was preserved. So he was declared as broad dead. After he reached to a hospital, he was declared as broad dead. So they tried with giving electric shock, they tried with giving injections, they tried with advanced airway support, they tried with any other procedure, but they couldn't able to revive him because it is more than 20 minutes after he stopped breathing. So after a person stops breathing, if you have the vital 10 minutes, that is first 10 minute called platinum 10 minute. Remember that it may not be practically within 10 minutes you cannot reach to the hospital. That's why while shifting a person to the hospital need to be practiced this step. Okay. Then open the airway and we start giving the mouth to mouth breathing. For every 30 compression, we tilt the head back, close the nose and blow through the patient casualty's mouth. So we blow through the casualty's mouth for the very reason to give mouth to mouth breathing. Right? Why we give mouth to mouth breathing? For tissue oxygenation. There is already oxygenated blood inside the body. We are supporting it with at least two two times breathing. And whenever you are breathing, you should observe the chest rise and fall. And how long we are supposed to give mouth to mouth breathing? It is for steadily you need to blow for 2 seconds. Remember, 2 seconds only, right? So blow forcibly. It is not like blowing a balloon. When we blow a balloon, it is continuous blow. It is a forcible blow, like forcibly we need to blow it, right? Remember. So practically when we show it, definitely it will be better for you to understand, but still you can make out and understand the knowledge through the online sessions also. But whenever you get a chance to practice practically, please do learn that procedure as well. That is very important. So rescue breathing, blow steadily for 2 seconds in the victim mouth, and we need to watch the chest rise and fall. Okay. So remember 30 is to 2. And what should be your position? See, your position when you are performing CPR should be comfortably seated with both the leg, both the knees down on the ground, not one leg down. So with a one leg down posture, you cannot do the proper CPR. With the both the leg down posture, then your hand should be perpendicular to chest. What should be the fulcrum of bending? The fulcrum of bending is from the backbone, not the elbow. What should be the amount of force? Hard and fast. More harder you compress, more blood will flow to the brain. Okay. So don't worry about the chest fracturing of the chest wall, or fracture of the rib cage, or fracture of the sternum bone. Fracture of the sternum bone is a remote possibility, but fracture of rib cage may happen. If it happens also, don't worry, there is a treatment for that. But don't stop doing compression hesitating for damaging or injuring the heart. Many people hesitate to compress with the force. They think that we may damage heart. No, you cannot damage heart with a compression. It is practically impossible. Okay, it's a pumping organ, it's a muscular pumping organ. When you compress it, it will pump the blood to the vital organs. So electrical stimuli to the heart was stopped due to some reason, and your hands are doing that job. So remember that. And that is for an adult, we use both the hand. For the children, so that is from 1 year to 3 years, we'll be using fingers. So just see the picture, 30 compression and 2 breath using the finger. And the children above the age of 3 to 15 years will be using one hand. So children above the age of 3 to 15 will be using one hand. So remember that. So that is again a very important thing to be remembered. That is children up to the age of 15, one hand only. Okay, sorry. Okay. So you can see here one hand and the two fingers. Two fingers for an infant. Infant, generally we say infant means to say below the age of 1 year. So it is depending upon the width of the chest, up to 3 years also can you use a finger. And then one hand for the uh, that is up to adolescent period, that is up to 15. Okay, so remember the 5 step. First, call an ambulance. So remember 108 or 112 emergency helpline number. Second, 30 compressions. So followed by opening the airway, then to breathe, rescue breathing, then followed by uh, compression. So 30 compression followed by 2 breathing, then it should be done till we apply the AED pad. What is AED? Automated external defibrillator. Automated external defibrillator. So these automated external defibrillators are the commonly available equipment nowadays in the public places. AED machines are kept that can be used for such emergencies. Okay, so that is about the CPR procedure. We are going to learn about the after CPR. We turn the casualty towards a recovery position. So remember all the 4 steps here: tilting the head back, opening airway, giving mouth to mouth breathing, and 30 compression. So this is required in case of a drowning. Drowning means to a condition where a person is drowned in water, or in case of a road accident after a person is profusely bleeding, we need this. Okay, so this is CPR. I'll be taking your questions later when we conclude the session, maybe around 1 o'clock. We will start discussing about all this. You can note down the questions related to the each incident, because we are going to discuss nearly 10 different topic, not only CPR. So every topic you may be having a doubt, or you may be having it, things to share. So you may have a question also. Please write it down and we can discuss that later. Okay, so next is, after a person uh, after helping a person who is unconscious and not breathing, the next severe person will be the injured person, will be the bleeding. So next will be the management of bleeding. So any injuries, whether it's earthquake, landslide, or a building collapse, the basic thing that is required is management of bleeding. So most of the people will commonly ask me, so if a person is bleeding at the same time he's unconscious, so whether bleeding needs to be attended first or unconsciousness. Unconsciousness, airway, breathing, circulation need to be supported first, followed by stopping the bleeding. If there are many people, one person can apply the direct pressure on the wound and stop the bleeding. Simultaneously, CPR can be performed. So remember, you may not be alone, all alone, or you means to say a first responder may not be all alone in the field. So they will be doing all this process in a team. One person can support, stop the bleeding, and the other person can do the CPR. Okay. So we are going to discuss now the management of bleeding, the first aid management of injuries now. And in injuries, the first thing is bleeding management. The second thing in the management of injuries is a fracture management and shifting the casualty. We are going to discuss that very briefly to make you understand what are the simple steps involved in the process of first aid of injury management. So remember, the bleeding can be classified into two, that is external, which can be seen outside. Internal means to say which is more dangerous. That is, in case of head injury or abdominal injury, you can see such type of bleeding. So such type of bleeding is quite common in case of road accident. That is internal bleeding, which is hard to diagnose, and the person may die within 1 hour. So externally, when the blood is seen, we suspect something serious. When the blood is not seen at all, we will be overlooking that into thinking that nothing has happened. Please do not assess a severity based on the bleeding. In most of the situations of an internal injury, there may not be any bleeding at all. In abdominal injury, there may not be any bleeding at all. So how we assess that, we are going to learn now. And what is the first aid also, we are going to learn. So there are 3 types of bleeding now. Generally, the injuries can be classified into many types. Like common injury that we can see in a disaster, maybe incised cut wound or lacerated or abrasion wound. This is for the knowledge of first responder. But generally, first aid remains same for all type of injury except for gunshot injury and punctured wound. Punctured wound means to say through and through a sharp object has passed inside the body, maybe during a disaster. So the first aid is slightly different, and for uh, gunshot wounds also the slightly different. Except rest of the wounds, we manage the first aid is same. Okay, so what is a medical emergency in bleeding? So medical emergency in a bleeding is bleeding from an artery and a vein. So bleeding from artery and vein is categorized as a medical emergency because it need to be treated within 1 hour. So if we do not assist the person, do not provide a first aid for a person who is having bleeding from an artery and a vein, the person may die due to the blood loss. How do we identify it? Simple to identify. Arterial bleeding is pulsating. bright red in color. Venous bleeding is dark red in color and continuous. In lower limb means lower leg injuries, we can see venous bleeding. Arterial bleeding generally can be seen in the upper part of the body. So arterial bleeding can be seen most of the time in amputation. Amputation means where hand is cut in an industry or after an accident. So how we stop the bleeding? What is the first aid? Right. So remember, as a first responder, it is very important to protect yourself, and gloves is required. When you manage any injuries, you need to have a barrier. A barrier can be a plastic bag. A barrier can be something cloth, or it can be a rubber gloves also. So make sure that you have an access to rubber gloves always. So the three simple steps to be remembered in bleeding management. External bleeding management, three simple steps are there. First step is direct pressure. Okay, so first we check for the wound. You check for anything which is embedded inside the wound, whether it's a glass, whether it's a mud or a stone. We clear that. Then we apply the direct pressure. So when you apply direct pressure, it need to be a clean cloth. It may be kerchief, it may be a bandage, it may be a gauze, it may be a sterile gauze, or whatever the access you have, you can use it. Earlier we used to say sterile gauze, we used to say bandage. So it may not be available in emergency. If you say bandage, it may not be. So use anything which is clean. It can be applied directly on the wound. First step. Second step, elevate the wound. So why do we elevate? Because to reduce the blood flow and blood loss. If the injury is to the leg, the first step is direct pressure followed by elevation. If the injury to the hand, first step is direct pressure, second step is elevation. If the injury is to the forehead, we make him to sit, we don't make him to lie down flat. Okay, remember the concept, three simple steps. First is direct pressure, second is elevation, and the third thing to be remembered is bandaging. So when we bandage, we can use anything, any cloth material which is clean, roller bandage, triangular bandage, anything what you have can be used to bandage. So why bandaging is required? Three important concept behind that. One is to hold the dressing, second is to reduce the blood loss, the third is to cover the wounds so that it doesn't get infected. Okay, so bandaging, where it is done, at the field level or hospital level? It is done at the field level. So don't think that it's a duty of a paramedic, it's a duty of a doctor to do the bandage. We will not do the bandage, we will send him like that only. So if you send him like that only, by the time he reaches to hospital, there will be excess blood loss. So that need to be prevented, with a method of bandaging, the proper method of bandaging. Remember three step: direct pressure, elevation, and bandaging. Okay, so that is for external injury. When it comes to other external injuries, sometimes injuries may not be simple. If you have witnessed any road accidents, you may have seen that the person will be bleeding profusely from all across the body. It will not be as so simple as shown in the diagram. So it will be bleeding everywhere. So then find out where there is a severe bleeding, where it is pulsating first. Then try to stop. Apply direct pressure and try to stop. Okay. Next is bleeding with a fracture. In case of a bleeding with a fracture, first is stabilize that wound. How to stabilize? You can use anything rigid. What can be used? You can use a scale, you can use a splint, you can use a plastic splint to stabilize it, to prevent further movement of the fractured end. Then we can put a bandage over that. Then what about the penetrating wound? What is penetrating wound? A sharp glass or a metal piece is pierced inside the body. Okay, this can happen during a road accident, it can happen during a train accident, it can happen commonly in the building collapse. The person ends up with a sharp object penetrating inside his body. So if that is a penetrating wound, don't try to take it out. So I'm repeating again, do not take it out. Whether it's a glass, whether it's a metal, whether it is a wooden piece, also don't try to take it out. If you take it out, the bleeding will be profuse. You cannot stop with a simple bandaging. It needs a suture. Okay, it needs staplers. Stapler means to stop the bleeding. Nowadays staplers are available. It needs a gum. Gum means to say not the Fevikwik. Huh? So I read the morning newspaper report, somebody put a gum for a wound, Fevikwik gum for the wound. So there is a different gum which is available now, a biocompatible gum to stop the bleeding. in case of any injuries. So that is available only at the hospital. Only medical professionals know where to use it, when to use it. So why I'm telling this, because you may be probably educating our students, so they may not be aware about all these things. They may end up doing this by after seeing some videos in the WhatsApp or some videos in their Instagram reels. So never ever apply anything. Don't try to pull out any object which is piercing inside. So what should be done? So we will put a ring pad. Ring pad means to say we prepare a ring, we keep it open. This part is kept open. So this we will be applying adhesive plaster, medical grade adhesive plaster over the ring. So ring pad means to say it is a simple ring which is made up with a kerchief. Okay, so we call it in Kannada. If most of the participants can able to understand Kannada, ಸಿಂಬೆ ಆಕಾರದಲ್ಲಿ ನಾವು ಬಟ್ಟೆಯನ್ನು ರೋಲ್ ಮಾಡ್ತೀವಿ. So it is made like a ring and placed over a uh, penetrating object, so to prevent further penetration as well as to control the bleeding. Okay, the last one before we break for the tea is regarding external bleeding from the nose. This is common thing that can happen in a bus accident. So if you happen to travel in a bus, suddenly if he applies a brake, our head will get banged to the next the seat, and that can result into the bleeding from nose. And bleeding from nose, it's not severe. It is not due to head injury. It is due to direct injury to the nose only. So it is a nasal cartilage. It's not a bone. It's very sensitive and soft. Even with the slightest hit injury, also it can bleed. So this will be profuse bleeding, and most of the time we end up doing wrong thing. We ask the person to lift his head back. So lifting the head back is not the right method. Please understand, that is a wrong method. If you are asking a person to lift the head back in case of a nasal bleeding, this is a commonest injury you can see in a landslide or a building collapse or a bus accident, because the nose get injured when a person falls, that results in bleeding. So lifting the head back is a wrong. So what should be practiced? So you will be probably uh, hearing this for the first time, that head should be tilted forward, not backward. Why it should be tilted forward is because it is very important to remember, if you tilt the head backward, the blood will not go inside the blood vessel. It will go inside the trachea, it will go inside the digestive system, and bleeding will be continuous for 10 to 15 minutes or half an hour. The blood start collecting inside the body. So what you are supposed to do is ask the person to bend the head forward, close the nose, and breathe through the mouth. Breathing through the mouth will help us to balance the breathing. At the same time, the clot will be formed around the nostrils, and it is safe and it will not harm the person. Ask the person not to meddle with the socket, not to forcibly blow through the socket. Okay, so remember, this is right. The first diagram is wrong, that we generally practice. So we generally ನಮ್ಮ ಕನ್ನಡದಲ್ಲಿ ನೀವು ಹೇಳ್ತಾರೆ ಕೇಳಿರ್ಬೋದು, ಯಾರಿಗಾರು ಮೂಗಲ್ಲಿ ಬ್ಲಡ್ ಬರ್ತಿದೆ, so they just apply cold water to the head, ask the person to tilt the head backward. No, that is wrong. So what you are supposed to do is tilting the head forward, closing the nose. So whatever I'm sharing here, probably this knowledge may be different than your understanding, but that's what the science says. Throughout world, this is remaining same. Okay, all right. So we will stop here. 11:15 was the time for the tea break was given. Sir, shall we stop here for the tea?
Yes, sir. Can take a break, sir. And we'll join at 11:45, sir.
Okay, madam. Fine.
Okay, thank you.